Great. Thank you, everyone. Thanks for joining. Good afternoon and welcome to today's COVID-19 update briefing. As you can see, I'm following CDC and IDPH guidance and quarantining after a member of my staff tested positive for COVID-19 early on Monday. There are a few other close contacts of this staffer, and each of us will be in quarantine until October 12th. That's the 14-day period that's recommended by public health officials as a precautionary measure. At this point, I and every member of my team who comes into the governor's office tested negative in an office-wide check Monday afternoon. I spoke with the staffer who tested positive, and they have some symptoms but are in good condition and resting at home. Let me take this opportunity to remind everyone that there is testing available to literally every person in Illinois, whether you've potentially been in contact with a COVID-19 case, if you're feeling unwell, if you just want to check in, you're able to get a test at no cost. You don't need insurance, you don't need to be a citizen, you don't need symptoms, and in most places, you don't need an appointment. You can find the state-run testing site closest to you, as well as a list of the hundreds of private and commercial testing sites across the state at dph.illinois.gov/testing. Again, dph.illinois.gov/testing. On to our COVID-19 update for the state. Over the last 2 weeks, 9 of our 11 regions have seen their average positivity rates decline, even as our state is performing tests at record numbers. That is really good news. Not every region is succeeding to the extent that we need. Unfortunately, yesterday, my administration announced that because it has surpassed 8% positivity for 3 days in a row, starting this Saturday, Region 1, home to Rockford and Dixon and Galena, will need to adhere to the COVID-19 resurgence mitigations. Those are the same ones that are currently applied to Region 4. IDPH has been in conversation with county health departments to discuss preventative measures that they can take at the local level. Region 1's concerning uptick in positivity, jumping more than 2 percentage points in 2 weeks, demands increased focus on stopping the spread. In the past week, Region 1 also has had an early indication of increasing hospital admissions for COVID-like illness. Although this increase has not yet reached the threshold level, it does indicate an increasing seriousness of the illness caused by the virus, so we're watching that closely too. Like the other regions that have exceeded 8% positivity, Tier 1 mitigations will be temporarily imposed, including all bars, restaurants, gaming facilities, and casinos will close at 11 p.m. All indoor bar service and indoor dining will be closed. Outdoor bars and dining may offer table service if they follow tightened mitigations, including that all patrons must remain seated and that reservations will be required for every party. Party bus services must temporarily close, and gathering limits will shrink to the lesser of 25 individuals or 25% of overall capacity in other locations. In the coming days and weeks, depending on whether we can slow the infection rate in Region 1, these mitigation measures could be removed. They could be maintained or even strengthened. To a large extent, the path forward will be up to the residents of Region 1. I encourage everyone to wear your masks, encourage others to wear their masks, watch your distance, and wash your hands. And if we all put our public health first, there will be fewer infections, and that means fewer restrictions and quicker return to normalcy. As has been the case, the average positivity rate over a 14-day period starting this Saturday will be the indicator. If the region gets itself below 6.5% for 3 days in a row, the new mitigations will be lifted and the whole area will return to the current phase 4 mitigations under the Restore Illinois plan. These rules are not meant to be a punishment, and I don't particularly enjoy having to deploy them. But we have got to keep people healthy and safe. The vast majority of our Restore Illinois regions, that's 9 of 11, so far have not required additional mitigation. Sorry, 8 of 11 have not required additional mitigations since all of the state reached the current phase of our reopening plan in late June. That's nearly 3 months to the day. We all want to have our schools and our businesses open, and we can do that by keeping community spread low and infections down. Illinoisans are proving that we can do that. They're proving it every single day. So thank you, and with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you so much, Governor. I will start with the case and test updates. Today, we are reporting 2,273 new cases of COVID-19 and unfortunately 35 deaths. In Illinois, we have now seen a total of 293,274 cases and 8,672 lives lost. 1,632 individuals across Illinois were reported to be in the hospital overnight with COVID-19. Of those, 378 were in the ICU and 152 were on ventilators. In the last 24 hours, more than 58,000 lab tests were reported for a total of more than 5.6 million tests. We are seeing some good trends, like in Region 7, which was able to move to phase 4 of Restore Illinois after implementing additional mitigation. But as the governor mentioned, we've also seen some troubling trends. In Region 6, which includes the University of Illinois at Urbana-Champaign, IDPH has been carefully examining the data. This is a really unique situation where repeated saliva testing for staff and students at the Urbana-Champaign campus results in a tremendous number of tests, up to 20% of all the tests done in the entire state. So while that region with those saliva tests is seeing a test positivity rate in the 2s, without Champaign County and those Urbana-Champaign tests, that rate skyrockets to over 7%. We want to ensure that the large volume of tests at Urbana-Champaign does not overshadow the trends that we're seeing in the broader region. And we don't want to be inhibited from taking action to keep people safe. Therefore, in addition to providing data for Region 6, IDPH is now presenting data for Region 6 without Champaign County's numbers. If regional metrics are tripped in Region 6 by looking at the data in this way, the entire region, including Champaign County, will still be required to implement mitigation efforts. IDPH is in contact with local health departments and community leaders in the region and is encouraging them to begin taking action right now to reduce the test positivity rate. As we enter fall and winter holiday seasons, IDPH is committed to ensuring our communities have the best public health guidance to stay safe. Today, IDPH released guidance for Halloween, which can be found on the IDPH website on the COVID-19 page under guidance. For Halloween, we are encouraging people to find ways to celebrate that might look a little different than in years past, but we still allow our children to take part in these festivities. Trick-or-treating could now involve just setting out individually wrapped pieces of candy spaced out on a table where kids in costumes socially distanced can still pass by and retrieve it. Activities like hay rides, pumpkin patches, orchard visits are allowed with limited capacity, masking, and social distancing. For anyone wearing a costume, Whether a child or an adult, a costume mask is not a substitute for face covering. If face coverings are worn under the costume mask, please ensure that this does not create any breathing problems. And if it does, don't discard your face covering, put the costume mask aside. Haunted houses are not permitted under Phase 4 of Restore Illinois. We are also asking adults to avoid crowded costume parties at home or at bars, which can absolutely increase your risk of getting COVID-19 and spreading it in the community. These are unprecedented times, difficult times, but I encourage people to accept the situation, but try to be creative this holiday season. Challenge yourself and your kids on how you can celebrate these holidays as safely as possible. Keep washing your hands, keep watching your distance, and keep wearing your mask. And of course, get your flu shot before the end of this new month coming October. The sooner the better. And now the comments in Spanish. Muchas gracias por su liderazgo, Gobernador Pritzker, durante estos tiempos sin precedentes. Hoy, el Departamento de Salud Pública de Illinois reporta 2,273 nuevos casos de COVID-19 y también 35 muertes. En Illinois hemos visto un total de 293,274 casos y 8,672 vidas perdidas. 1,632 personas en Illinois pasaron la noche en el hospital con COVID-19. De ellos, 378 pacientes estaban en la unidad de cuidados intensivos y 152 pacientes estaban en ventiladores. En las últimas 24 horas se informaron más de 58,000 pruebas de laboratorio fueron hechas. Estamos viendo algunos buenos cursos, como en la región 7, que pudo pasar a la fase 4 de restaurar Illinois después de implementar mitigaciones adicionales. Pero también estamos viendo algunos cursos que nos preocupan. Aumentos en la región 1 y la región 6. En la región 6, que incluye la Universidad de Illinois en Urbana-Champaign, IDPH está examinando los datos. Esta es una situación única en la que las pruebas repetidas de saliva para el personal y los estudiantes dando resultados de una gran cantidad de pruebas, hasta el 20% de todas las pruebas realizadas en el estado. Si bien la región está experimentando una tasa de positividad promedio de 7 días de 2%, sin el condado de Champaign, esa tasa se dispara al 7.2%. Queremos asegurarnos de que el gran volumen de pruebas de la universidad no eclipsa el aumento que estamos viendo en la región. Por lo tanto, además de proporcionar datos para la región 6, IDPH ahora presenta datos para la región 6 sin el condado de Champaign. Si las métricas regionales se disparan en la región 6 con estos datos, toda la región, incluido el condado de Champaign, aún deberá implementar esfuerzos de mitigación. IDPH está en contacto con los departamentos de salud locales y los líderes comunitarios en la región. Van a comenzar a tomar medidas ahora mismo para la tasa de positividad en las pruebas. Ahora que ha llegado el otoño y el clima más fresco, la gente pasará más tiempo adentro y eso puede aumentar la propagación del COVID-19. También estamos cerca de los días festivos de Halloween, Día de los Muertos, Diwali, Acción de Gracias, Hanukkah, Navidad, Kwanzaa y Año Nuevo. Estos días festivos siempre están llenos de reuniones que no permiten el distanciamiento social. Pero como he dicho, hasta que no haya una vacuna confiable que esté disponible, debemos coexistir con COVID-19. Esto significa que tendremos que celebrar nuestras fiestas de manera un poco diferente. Para Halloween, pedir dulces podría implicar colocar dulces envueltos individualmente, espaciados, en una mesa donde los niños disfrazados pueden pasar. Las fiestas de disfraces para adultos en casa o en bares pueden aumentar su riesgo de contraer COVID-19 y propagarlo en la comunidad. Pero para cualquier persona que lleve un disfraz, sea niño o adulto, una máscara de disfraz no es un sustituto de una cubrecara. Las casas embrujadas no están permitidas en la fase 4, pero los bosques embrujados al aire libre o los paseos embrujados se pueden hacer con distanciamiento social y las máscaras. Se permiten paseos en heno, pero solo con capacidad limitada y con distanciamiento social. También se permiten visitas rachos de calabazas y ajuertos con las máscaras y distanciamiento social. Estos son tiempos sin precedentes y tiempos muy difíciles para todos, pero animo a la gente a aceptar las diferencias y tratar de ser creativos en estas temporadas festivas. Por favor, siga lavando las manos, observando las distancias y usando sus máscaras. Y es muy importante de vacunarse contra la gripe antes del final de octubre. Muchísimas gracias. And with that, I'll turn it back over to Governor Pritzker.
All right, we'll open it up to some questions. We'll start with one from KMOV in St. Louis. Governor, would you honor St. Clair County's request to be its own region as opposed to being part of Region 4?
Well, as you know, we've made sure that these regions have actually gotten smaller over time. We had 4 regions in the state of Illinois. We now have 11. They follow the regions, the health regions that are set out by the Department of Public Health. And we're working very hard with the neighboring counties around St. Clair, but just to be clear, people travel in that region. They travel between counties. It is not a good idea, in my view, for us to break this down into 102 counties across the state of Illinois. But instead, if we can work with the counties and particularly their county public health officials to bring down their positivity rates, that is the right solution. So we're all doing that. I can very much appreciate the work that's been done in St. Clair County to bring down the positivity rate there. We're getting very close. We just need to work on the other counties in the region.